You also want to look again at color and texture of the neck while you're here. Another thing that you want to do is palpate. So this would be done by getting to the side of the client, asking him to keep his head like this and just palpate. With 2 fingers, you can palpate the thyroid. You never want to press too hard because it will release thyroid hormone. So you palpate, and I can see that there's no goiter, there's no swelling. So at this point, I'm done with this assessment up here. The next thing I'm going to check is the ears. First, with the ears, we're going to, I'm going to ask the patient if they could please, before I move on to the ears, if they could shrug their shoulders for me. Shrug, up and down, good. And move the head side to side. Okay, by shrugging the shoulders, I'm checking for cranial nerve number 6, and that is a motor cranial nerve, and that is showing that the patient has good romp of the neck within the cervical. The next I'm going to move on to the ear. First thing we're going to do with the ears is just an overall inspection. Want to make sure that there's no redness, there's no drainage. We also want to make sure that we can palpate the outer part of the ear and the auricle and the tragus. If you palpate and they grimace or show any sign of pain, this is something that we would want to further investigate, and we would again do that bilaterally, the auricle and also the tragus, which is in here and then around. And the patient shows no grimacing or no signs of pain. The next thing that we're going to do is we're going to test cranial nerve number 8. Test cranial nerve number 8, and we're going to first do that by occluding one part of the ear and then stepping behind the client and whispering numbers that he would have to then repeat. So
99, 22, 77.
That showing that the client can hear, and by hearing is he can hear correctly bilaterally. So you would want to do that on the other side, and you would close again this ear, and you would whisper the numbers on this ear again, and he would then repeat them. The next thing we're going to do is actually look inside with an otoscope inside the client's ear, and you want to make sure the light is on. You want to make sure that you're actually in a dimmer lighting setting. But for the purpose of the video, I'm not going to do that, but you want to be in a dimmer lighting setting so you can really see inside the client's ear. You want to look with the adult client, you're going to pull up and back, and you're going to look in the canal of the ear, and you're looking for a clear white tympanic membrane, which his is a pearly white color. And his ears climb, there's no polyps, there's no drainage, and everything looks good. You're going to do that bilaterally, so you're going to go up and back again, and look in and see that it's clear and it's a pearly white, and that there's no, polyps or drainage or anything else in the ear, which everything looks good. The next thing is we're going to check for cranial nerve 8, which is the vestibular cochlear cranial nerve, is we're going to be checking using the Weber and the Rhine test. With the Weber test, you take a tuning fork and you spike it on your hand or your knee, and you place it above the client's head, and you ask them to tell you when it stopped.
It stopped.
And that's showing that he's able to hear bilaterally in the sensation. The other test is called the Rhine test, and that's done with air and bone conduction. And you again spike the fork, put it on the mastoid process, and then when it stops, you ask the client if they can hear it outward.
I hear it.
And if they can hear it here, then at this point you know that the air conduction is greater than the bone conduction, and that's done bilaterally.
I can hear it.
Beautiful. The next thing we're going to check is the nose. And we first, of course, we want to visualize the nose. We're looking for symmetry of the nose, that there's no deviation. Deviation would be seen just by looking at the nose. It could, tear off to the right or tear off to the left. Then we ask the client to look up, and then We want to inspect inside the nose to make sure there's no polyps, no drainage, or nothing that we don't want to see, and everything looks good. And the septum looks good. There's no deviation seen. The next thing that we're going to do is ask the client to close their left side, and then close your eyes and smell deeply. And what do you smell, sir?
Cinnamon.
Wonderful. Close the other side and smell.
Cinnamon.
Wonderful. By doing this, we're showing that both nostrils are both patent because he's able to breathe in the scent, and also we're checking the olfactory nerve, which is cranial nerve number 1. The next area that we're going to be checking is the mouth.